Hi there, future teacher. Welcome to your study guide refresher for the Michigan Test for Teacher Certification, MTTC, Field 116, Emotional Impairment. This video is designed to walk you through the key concepts, frameworks, and strategies you need to know to pass the exam. Whether you're brand new to the field or just need a focused review, you're in the right place. Let's get into it. Before we dive in, we put together a free study guide workbook that goes along with this video. It has all the key terms, practice questions, and space for your own notes. Grab your free copy from the link in the description. It's a great companion as you work through this material. This video is brought to you by TeacherPreps.com. Our full exam prep platform includes complete study guides for every competency, full-length timed practice tests that match the real exam format, vocabulary exercises, and AI-scored constructed response practice. It's free to get started, so head to TeacherPreps.com when you're ready for the full experience. All right, that was our plug. For the rest of this video, it's go time. Grab your pen and paper. Let's start with the exam format, so you know exactly what you're walking into. The MTTC 116 is a computer-based test with 100 multiple-choice questions. You have 2 hours and 30 minutes of actual test time, and your total appointment is 2 hours and 45 minutes. That works out to about 90 seconds per question, which is a comfortable pace, but you still want to practice not dwelling on any single question. The passing score is 220, and the test fee is $129. The exam is divided into 4 subareas, and knowing these weights is critical for prioritizing your study time. Subaria I is understanding students with emotional impairments, worth 13%. Subaria II is assessing students with EI and developing individualized programs, worth 27%, the heaviest single Subarea. Subaria III is teaching students with emotional impairments, worth 40%. And Subaria IV is working in the professional environment, worth 20%. In this video, we'll cover Subareas I and II, which together account for 40% of your total exam score. The remaining 60%, Subareas III and IV, is covered in the full course at TeacherPreps.com. Let's start with Subaria I, understanding students with emotional impairments. This subarea is worth 13% of your exam and contains 2 objectives. The first objective covers human development and learning theories, and the second covers the nature of emotional impairments themselves, their characteristics, causes, and how they manifest in educational settings. Think of this subarea as the theoretical foundation that informs every instructional and assessment decision you'll make as an EI teacher. Let's dig into the development theories you need to know for this subarea. First is Erikson's psychosocial theory. The stages most relevant for school-age students are industry versus inferiority, around ages 6 to 12, where children develop competence and a sense of mastery, and identity versus role confusion, adolescence, where students are forming a sense of who they are. Students with emotional impairments may struggle especially in these stages due to disrupted relationships, trauma, and academic challenges. Second is Bronfenbrenner's ecological systems theory, which describes a student's environment in layers. The microsystem is the immediate setting like family and classroom. The mesosystem is the connection between settings. The exosystem includes community influences like parent employment. And the macrosystem is the broader cultural context. Now let's talk about emotional impairments themselves. Common conditions you'll encounter in the EI classification include anxiety disorders, depressive disorders, post-traumatic stress disorder, mood dysregulation disorder, oppositional defiant disorder, and conduct disorder. A major concept for the exam is adverse childhood experiences, or ACEs. These are traumatic events in early life, such as abuse, neglect, or household dysfunction, that have documented effects on brain development and long-term health. Trauma affects the brain through hyperarousal, emotional dysregulation, and avoidance behaviors. Students who have experienced trauma may struggle to feel safe, regulate their emotions, or trust adults. Emotionally, these challenges directly affect academic performance. Students with EI often show reduced attention, lower motivation, impaired memory, and higher rates of absenteeism. You should also know that many students with EI may take psychotropic medications. Teachers need to understand potential side effects, like drowsiness or appetite changes, and communicate observations to parents and school support teams. Finally, know the difference between risk factors, things like poverty or family instability that increase vulnerability, and protective factors, which are strengths like a supportive adult relationship or community connections that build resilience. Let's do a practice question for Subarea I. A fifth-grade student with an emotional impairment who experienced early childhood trauma frequently becomes dysregulated during transitions between activities. Which of the following strategies would be most effective for supporting this student? Option A, warning the student about the transition 5 minutes in advance using a visual timer. Option B, eliminating as many transitions as possible by keeping the student in one location all day. Option C, removing the student from class when dysregulation occurs to prevent disruption to other students. Option D, asking the student to explain their behavior immediately after each transition occurs. Take a moment to think about your answer. The correct answer is A, warning the student about the transition 5 minutes in advance using a visual timer. Transitions are unpredictable stressors for students who have experienced trauma, and the visual timer provides concrete, predictable warning that reduces uncertainty and supports self-regulation. Option B, eliminating all transitions, is impractical in a school setting and doesn't build the student's capacity to cope. Option C, removing the student, is punitive and removes the learning opportunity without teaching replacement skills. Option D, asking for an immediate verbal explanation, occurs when the student is still dysregulated, meaning they lack the cognitive capacity to reflect and respond meaningfully. On test day, look for answers that use proactive, trauma-informed strategies that build skill rather than simply react to behavior. Now let's move into Subarea II, assessing students with emotional impairments and developing individualized programs. At 27% of the exam, this is the heaviest subarea we're covering today, so pay close attention. It contains 4 objectives: understanding assessment instruments, implementing assessment procedures, developing IEPS and BIPS, and monitoring student progress over time. All 4 objectives are about turning assessment data into actionable individualized support. The first objective covers assessment instruments, the tools used to understand student behavior and emotional functioning. The most important tool to know is the Functional Behavioral Assessment, or FBA. An FBA examines the ABCs of behavior: antecedent, what happens immediately before the behavior, what the student actually does, and consequence, what happens afterward. Understanding the function of behavior is the goal. There are 4 main functions: escape from a task or demand, access to attention, access to a tangible item or activity, and sensory stimulation. Formal rating scales are also used for eligibility and progress. The BASC-3, or Behavior Assessment System for Children, is one of the most widely used. Others include the Child Behavior Checklist and the Connors Rating Scales. You need to know the difference between norm-referenced assessments, which compare a student to a standardized sample, and criterion-referenced assessments, which measure performance against a specific skill standard. Also review concepts of validity. Does the tool measure what it claims to measure? And reliability. Does it produce consistent results? The second objective covers how assessment is conducted within the school system. The multi-tiered system of supports, or MTSS, is the framework for identifying students who need intervention. Tier 1 provides universal instruction and supports for all students. Tier 2 provides targeted, small group intervention for students who are not responding adequately to Tier 1. Tier 3 provides intensive, individualized intervention, typically for students who may qualify for special education. Michigan's eligibility criteria for emotional impairment require that a student exhibit one or more specific characteristics, such as inability to learn that cannot be explained by intellectual, sensory, or health factors, to a marked degree over a long period of time. Parental consent is required before conducting any initial evaluation, and families must be meaningfully involved throughout the process. Assessments must also be non-biased, conducted in the student's native language, and free from racial or cultural discrimination. Communicating assessment results clearly and sensitively to families is a professional and legal responsibility. The third objective covers the Individualized Education Program and the Behavior Intervention Plan. An IEP must include the student's present levels of academic achievement and functional performance, measurable annual goals, special education services, supplementary aids, and placement in the least restrictive environment, or LRE. For students with EI, behavioral goals must be measurable. For example, a good behavioral goal specifies the behavior, the conditions under which it occurs, and the criterion for success. When behavior significantly impedes learning, the team develops a behavior intervention plan. A BIP identifies the target behavior, the function it serves, modifications to antecedents that trigger the behavior, a replacement behavior that serves the same function, and a reinforcement plan. You should also know the Manifestation Determination Review, or MDR. This is required when a student with a disability faces a disciplinary removal of more than 10 school days. The team determines whether the behavior was caused by or had a direct relationship to the student's disability. If so, the student cannot be removed. The team must instead address the behavior through the IEP and BIP process. The fourth objective covers how teams monitor student progress over time. Behavioral data collection methods include frequency recording, how often the behavior occurs, duration recording, how long each episode lasts, and intensity recording, how severe each episode is. For academic goals, curriculum-based measurement probes provide quick, repeated snapshots of student performance in areas like reading fluency or math computation. Teams need decision rules to determine whether an intervention is working. Generally, if a student's progress trend line is below the goal line after sufficient data points, the intervention should be adjusted. Adjustments might include changing reinforcement, modifying the environment, increasing instructional intensity, or adding new supports. General education teachers and families should be included in progress review meetings. Families have legal rights to receive regular updates on their child's goal progress, and their input is valuable for understanding behavior patterns across settings. Practice question for Subarea II. A school team has completed an FBA for a 7th grade student with emotional impairment. The FBA reveals that the student's disruptive outbursts primarily occur when asked to complete written work independently, and that the behavior is maintained by escape from the task demand. Which behavior intervention plan component most directly addresses this function? Option A. Implementing a token economy where the student earns points for on-task behavior. Option B. Teaching the student to request a break using a predetermined signal before becoming dysregulated. Option C. Removing all written work assignments from the student's daily schedule. Option D. Increasing the frequency of disciplinary referrals to reinforce the seriousness of the behavior. Take a moment to think about your answer. The correct answer is B. Teaching the student to request a break using a predetermined signal before becoming dysregulated. Because the behavior is maintained by escape, the most effective BIP component is a replacement behavior that allows the student to meet the same need, escape from demand, in a socially appropriate way. A break card or hand signal accomplishes this and builds self-advocacy skills. Option A, a token economy, can be a useful support but does not directly address the escape function driving the behavior. Option C, removing all written work, eliminates the demand but does not teach the student to cope and is neither appropriate nor sustainable. Option D, increasing disciplinary referrals, is counterproductive. If the behavior functions as escape, more consequences that remove the student from the task may actually reinforce the behavior. On test day, always match the BIP strategy to the identified function of behavior. Nice work making it through Subareas I and II of the MTTC 116. You've now reviewed the foundational theories of human development, the characteristics of emotional impairments, and the full assessment and individualized programming cycle, including FBAS, IEPS, BIPS, and progress monitoring. But here's the reality check. Those two subareas together are only 40% of your total exam score. Subarea III, teaching students with emotional impairments, is worth 40% on its own, and Subarea IV, working in the professional environment, is worth another 20%. That's 60% of your exam still to go, covering instructional strategies, classroom management, transition planning, professional collaboration, and ethics. Get the complete preparation for all 4 subareas at TeacherPreps.com. You'll find full study guides, timed practice tests, vocabulary flashcards, and everything you need to walk into exam day confident. Link is in the description. Good luck, you've got this.